Question 6 of the multiple choice asks students to examine the data given in the table below. So we've got cost of medical treatment increasing, visits to doctors increasing, age of Australian population increasing, population of Australia is also increasing. What does the data in the above table represent? So what we're looking at here is all these things are increasing. So what's the data trying to tell us? So it says the main reason why curative services are being reduced in Australia. To me, that makes no sense at all because everything's sort of increasing. We're talking about curative services being reduced. We've got more people going to the doctor, older population. Can't be right. The main reason for the different life expectancy rates of males and females. Nothing in the table leans towards males and females. Can't be there. The main reason why Australia cannot significantly increase national spending on preventative health care. Yeah, I'm not really convinced on that one either. The main reason why there is a decreased burden on Medicare and the pharmaceutical benefit scheme. This is the one that's, for me, is the more the correct answer, is D. The main reason why there is a decreasing burden on Medicare and the pharmaceutical benefit scheme. Cost of medical treatment is increasing. Visits to doctors is increasing. Also, our population is increasing, as well as the population of Australia is increasing. So there's more and more people putting pressure on Medicare with the private health insurance to try and reduce some of this issue. That's why the answer would be D for 6. 7. Why is it important to use the principles of social justice as a way of promoting health? All right, so principles of social justice. It decreases the burden on Australia's Medicare system. It can be measured more successfully using epidemiological data. It provides the best opportunity to improve the health of all Australians. It acknowledges that individuals have the capacity to make informed decisions. So, why is it important to use principles of social justice? Social justice meaning everybody having access, everybody having the chance to be involved. It decreases the burden on Australia's Medicare system. That would be more if I was talking about private health insurance. So no, it can be measured more successfully using epidemiological data. It's got nothing to do with that, has it? So again, we take him out. It acknowledges that individuals have the capacity to make informed decisions. How that relates to social justice principles, I'm not sure. I've done that again. It provides the best opportunity to improve the health of all Australians. All Australians is social justice. So the most correct answer for number 7 is C. Now question 8. Examine the data given below which compares the cause of death rates of Indigenous Australians to non-Indigenous Australians. Causes of death, so 6.6 times more likely to die from. That's what we're trying to work out. Twice as likely to die from cardiovascular disease. The Indigenous Australians, 1.2 times as likely to die from cancer, more than twice as likely to die from respiratory disease. Now, obviously, with this question here, I've given you either B or C would be correct. When I went and looked through some of the textbooks to find out the different statistics up here, to me they're all over the place. So the most correct answer in this case here, it can't be colorectal cancer, it can't be transport injuries. It's got to be either diabetes or suicide, purely based off some of the statistics that are given here, and as close to them as I could get or find. Then the answer would be B or C. So B or C was the correct answer here. Number 9, which of the following statements best reflects the impact of Australia's ageing population? So we're looking at Australia's ageing population. The health disadvantage of this group has decreased. Doesn't really make much sense to me, no. Funding for public hospitals in Australia has decreased. The pressure on the Australian health system has decreased. The availability of carers and volunteers for the elderly has decreased. Well, for me, that comes back to that's a syllabus dot point. The impact of Australia's ageing population is that there's not going to be, because we've got more people older or living for longer now, we're not going to have enough people to be looking after them. So that's going to, for me, that's the biggest concern. That will be the one there. That one best reflects the impact. So D is number 9. In question 10, examine the data below. Increased occupational injury rates, reduced access to healthcare services and personnel, higher driving risks, higher rates of suicide. Which of the following groups experienced the health inequities described above? So we have a look at this. So straight away we know that they've got increased occupational injury rates. They've got reduced access to healthcare services. So males can't have reduced access if females don't, so we get rid of that. We could talk about the elderly, but I don't think the elderly have really higher rates of suicide, so I'm going to take that out. People with a disability, I don't know about occupational injuries. I don't know about driving risks. So again, I'd be taking that one out. And for me, the easy one was for people living in rural and remote areas. A lot of farm work, a lot of mining, occupational injuries, their location, access to healthcare, driving risks and rates of suicide because of the loneliness, being isolated, and the poor roads and all these issues and the maintenance of the cars. So number 10, D is the correct answer there.